Hello everyone, this is Dr.Aparna. I'm a senior consultant and fertility specialist in Oasis Fertility. So what is recurrent implantation failure? Recurrent implantation failure means that they have had at least 3 failed IVF attempts in spite of transferring good quality embryos. So why does this happen? You have transferred good quality embryos but still the embryo has not implanted. So as we know, the implantation of the embryo is actually a dialogue between the endometrium, that is the lining of the uterus, and the embryo proper. So it's between the seed and the soil. The embryo is the seed and the endometrium is the soil. So both should be perfect and synchronized so that the implantation can occur. If there is a problem in either, then the implantation will not occur. So what could be the problems? One, the embryo may be morphologically normal, but it could be genetically chromosomally abnormal. So what do we do about it? How do we go about it? So we do a test called the pre-implantation genetic testing. We test the embryo to see. So we take out some cells from the day 5 embryo and we send it for analysis, and we see whether the embryo is chromosomally normal or not. Only if it is normal will the result come as euploid embryo. So then we can transfer the embryo. Now what about the endometrium? One, so whether the endometrium was of sufficient thickness or not, whether the thickness of the endometrium was good, but at least it was 7 to 8 millimeters, how was the pattern of the endometrium, whether the endometrium looked healthy, did the endometrium have any infection inside, was there any fluid during the transfer, or was there any hydrosalpinx, that is, was there any fluid inside the tubes which could have come into the endometrium and flushed out the embryos. So these are all the reasons why the implantation may not have happened. Another test what we do normally is whether the endometrium was genetically receptive for the when we implanted the embryo, when we transferred the embryo. So this test what we do to see whether there is a receptive endometrium is called the ERA test, endometrial receptivity array, in which we test whether the endometrial genes are synchronized to receive an embryo on that particular day. So we get the results as whether we should do the transfer on that particular day, or we should do the transfer one day before or one day later. So these are all the tests that we should do. Another important thing is whether there is any autoantibodies inside the woman itself. So we do a testing called the antiphospholipid antibody screening, in which we test for anticardiolipin, lupus anticoagulant, beta 2 glycoprotein antibody. So these also may cause recurrent implantation failure sometimes. Usually it doesn't. Usually it leads to more of recurrent pregnancy loss, but we also do this testing to see. So the mainstay in recurrent implantation failure is what we do is, one, a PGT testing to see if the embryo is genetically normal, and only then do we transfer the embryo, and the next we see whether the endometrium is genetically receptive. So we do an ERA test called the endometrial receptivity array.